Thank you so much for wanting to even check out this bonus content that I put together for you. This is something I use with some of my clients. It's a little bit more grittier. It's a little bit more, I guess, intense. What happens is if you go too fast, too hard when it comes to your QL or any muscle you're trying to smash, stretch, and get to submit to what you want it to do, you have to be slow, you have to be cautious. So take what you've learned in the article that you're coming from. You always want to smash first. You want to get in there with a ball, lacrosse ball, or a PVC pipe. I'm going to show you here. Get in there and release some of the tissue first, and then get into stretching it. So today I want to show you two extra techniques that I use. One is finding if your QL is even tight. Two, how to use this super awesome PVC pipe. You can use a broomstick, you can use a branch, snap it off a tree and stick it into your side, or you can use a lacrosse ball, which you're kind of familiar with. So let's look at first how to know if you have a tight or an inflamed or an irritated or a pissed off Quadratus Lumborum, okay? Very simple. What you're trying to focus on is finding the area of where the QL is, okay? So a lot of people have this area between their ribs and the top of their pelvis, okay? It's like this 2 to 3 finger slab of space that usually you can dig your hands into and get to where that spine, those erectors, and that QL is. Take your hand, find that meaty space where, okay, I'm not pushing on I'm not pushing on ribs, or I'm not pushing on my pelvic bone. I'm pushing in that 2 to 3 finger meat that you can kind of push into, okay? You're not gonna go directly in this way. You have to still go off to the back. So it's not here, because now I'm pushing on my erector. It's right off to the right and left, depending on what side you're on, of that erector. So go in from the side, try to relax, because what happens if I do this, if I tense and come off the side this way or this way, it flexes. So it's gonna feel tight, but you're actually contracting it. Once I'm nice and relaxed, I'm gonna push, and if I feel a muscle in there and it's super stiff, super rigid, and almost painful to the touch, odds are that's gonna be your QL that's kind of locked up. And what you can kind of do to confirm that, dig that finger in there. Once I feel that, I'm gonna kind of bend back and forth this way and see if it'll let me get a little bit deeper with my thumb. So if you can dig in there and you're not feeling anything and nothing hurts, odds are that side isn't bad. If it's your left side, do the same thing. You're gonna test both sides, kind of going into that, doing this motion here, and digging in a little bit deeper, see if you can put your thumb or fingers around that QL and get a good confirmation on that pain. The next thing we're gonna look at is releasing the QL with a PVC pipe. So in this case here, what I would suggest you to do is get like a sock or get some kind of like cap on this here and do some duct tape. Or you can go to actually Lowe's or Home Depot and get the cap that fits over this and then wrap that with a few pieces of tape, make it a little bit softer. I'll take my PVC pipe and I'll put it into the side here. I'm trying to find that QL. So in this case here, my QL is right there. So what I'll do is I'll put that PVC pipe right over where that QL is. And when it's there, that's when I'll do some bends this way. And I try to, every time I bend a little bit, I try to relax a little bit more and allow my body to sink into that PVC pipe or that rod or whatever you're using. And I'll kind of sit here. The key thing is to be able to breathe, relax, and allow whatever you're using as a tool to do all the work. If you're trying to yank and dig yourself into it, you're gonna end up contracting things and it's gonna be a mess. All right, so here's another quick lacrosse ball release technique on the QL. Very simple. You can do it anywhere. Just make sure you have a lacrosse ball. Tennis ball might be a little bit too squishy. Racquetball, same situation. So lacrosse ball, just to get a little in there deep enough, you might want to use that. So I'll show you how it goes. So where I'm putting this, I'm looking for that QL area, coming in from the side, mashing in between that 2 to 3 finger spot of meatiness between my lower rib and my pelvis. I'll take my ball and I'll put it right where I want it to be. Again, I'm not going straight down on top of it. I'm almost like finding where it's at, lifting up on my pelvis or my hips, turning and then coming back down on top of it. You might have to adjust a little bit to kind of find where specifically it is for you. I like to take my leg out straight, see if I can find where it's at. And once I kind of feel it, which I think is right there, what I'm gonna do is I'm gonna bring my knee in towards my chest. So right there, nice and slow, making sure that as I'm pulling in, I'm exhaling, and that ball should be right on top of that QL. You can experiment with having your other leg straight. I don't really like what that does. I like to have this allows my pelvis to kind of come a little bit more neutral, which allows me to dig a little bit deeper. So I prefer left knee or right knee, whatever you're doing, to be bent at 90. From here, you got the knee to your chest aspect. Now what you're gonna do is you're gonna bring your knee to your chest, as well as bring your upper body up. So you're kind of creating a crunch effect. So what this looks like, bringing my knee in, and I've got it to a point where I'm not super rounding my lower back out. I'm gonna bring my chest up to my knee, and that just is brutal. That's smoking that QL. So I'll kind of move a little bit. There's not a whole lot of movement you can do as far as up and down goes, but I will adjust, come up, exhale, and allow myself to sink into that ball. So what I'll do, a couple reps, I'll hold here for about 15 to 25 seconds. If you find a really good gnarly spot, you can pin it down, bring your leg up. If that's not enough, again, come up with the crunch, and you can hold for longer than that. All right, so you got the smashing down, now we're gonna stretch it. Lots of different kinds of QL stretches you can do. You can go back to the article, and I got some stuff you can do on the actual stairs. This one is you're not gonna find on the article. This is a little bit more passive. If you have some kind of disc injury, you're dealing with some flexion intolerance, which means if you're bent like this a lot, that's what caused you pain. Be careful of this, watch out for it, okay? I don't want you to create more pain just by stretching. Okay, what I want you to do is take your hand, you can pin it on the inside, outside, doesn't really matter, it's not super scientific. Just pin your arm down, leg is bent here, you're not doing much of this, knees bent here, not doing much of that either. It's all about the angle you're putting on where I'm stretching my left side. So you can do left side, right side, whatever you want to do. After you've smashed it with your lacrosse ball, you're gonna get into this little stretch here. What you're gonna do is I like to reach around, grab the bottom of my foot, lay my foot down. This kind of pins this whole side of my body down, and I'm gonna turn my chest out, okay? And then from here, I'm actually gonna lean. I'm not necessarily leaning towards my foot, I'm leaning that way because ultimately I'm trying to get stretch in this QL. So doing this isn't stretching my QL, doing this is stretching my QL. So when you're doing this, you have to kind of play around with the angles. Here, I can pin my leg down here, and I'm pushing off my leg as I'm allowing that space to come into that QL area, and I'll kind of push back and I'll twist. So I'm trying to bring my chest a little bit like this and towards the ceiling. And I'll exhale, inhale for about a minute. Switch sides. Legs bent up, grab my foot here, pin it down. Again, you have to kind of maneuver yourself, move around a little bit, turn, and this side actually isn't as tight on me, but you have to kind of play around with what angle works best for you. If you don't want to pin it down, if you're able to get more space by bringing your arm up, you can definitely do that. I like to keep it simple. And turn and come towards that side. All right, guys, there you have it. I call it the trifecta. You've got the tissue release with the PVC pipe. You've got the tissue release and a little bit of stretching involved with it, like tack and peel technique with the PVC pipe and the lacrosse ball. Then you have the stretching going on from the article, and also adding in this a little more of a passive stretch you can do here that you found in this video. Thank you so much for watching, guys. The key thing here is time. Make sure you do it every single day. Spend at least 30 minutes max on actually working on your QL. That just gives you a lot of good attention to the area, starting off with the PVC pipe or stick or broom, whatever you want to use, moving on to the lacrosse ball, and then finishing off with some nice deep breathing and stretching in that area. Don't go away. There's another download I want you to have that I've put together for you just to have a guideline that you can follow while you're working through trying to unlock this QL, okay? So it's gonna take time, be patient, you have the tools. Stop searching, you don't have to go anywhere else. Don't search any more thing on Google. Take what I've given you, put it to work, and then make sure you email me in a couple of weeks and let me know how much relief you're getting from the QL little program I put together for you. Okay guys, thank you so much for watching. If it helped, this is a private video with a private link. So if you want to share it, by all means you can do it. But the only place that people can find this video is through the link that you produce, because again, this is a private video. So thank you so much. I got lots of more content coming your way regarding all different kinds of things when it comes to stretching, when it comes to getting relief from your lower back pain. See you guys at the site.